Hi, I'm Sabrina Brown, founder and CEO of Girlfriends Tea, where we offer magnificent luxury tea with your enjoyment in mind. Girlfriends Tea ranks within the top 5% globally of luxury teas. You can visit us at girlfriendstea.com and click on Shop Now, where you receive delicious flavors such as Uniquely Golden, Unapologetically Berry, The Other Bourbon, and the ever-popular Belle of the Ball. Because ladies, we are all the belle of the ball. I invite you to try a sample pack if you're visiting for the first time so that you can try all of the flavors. Thank you for joining me for a cup of tea. Everyone, welcome to our episode with Dr. Stephanie Marioneaux. She's an ophthalmologist. She's an eye surgeon. She's my doctor. So I'm delighted to have her here. And you know I'm delighted to have my girl come on in the room, co-host Tamika. How are you feeling, girlfriend?
I am feeling great, and excited to be here to hear another phenomenal interview. And also excited to talk about Sabrina's amazing luxury Girlfriends Tea that you can purchase at girlfriendstea.com. The sample of the day for me is Belle of the Ball. Okay.
Oh, Belle of the Ball. And who was that named by, Tamika?
It may be me, but yes. It is
named in honor of my girl, Tamika, because she is thebomb.com. Well, you know who else is thebomb.com? I've learned a lot about her. Oh my goodness. I looked her up. I said, whoa, I'm honored to have her. Come on in the room, Dr. Stephanie Marioneaux. We're happy to have you here with us. Good morning. And we have a guest with us, and I'll let you introduce our guest.
Oh, this is my wonderful husband, Dr. Harold Marioneaux. He is a dentist and an educator and just a great husband and father, and really appreciate him coming today.
Outstanding. Well, to both doctors, Marioneaux, we're happy to have you here, and we want to thank you for joining us for a cup of tea.
Yes, I have my tea.
Yes, and we're happy to be here. And you know what? I would be remiss if I did not share, Tamika, about your product, Art of the Stomach. I want you to tell us about Art of the Stomach. I have a mix here in the house.
Oh, Art of the Stomach is a little business that I'm still growing, slowed down just a little bit, but it is like keto-friendly treats and things, so low carb or whatnot. So still working on, but right now specialty is brownies, and then I'm still trying to work on a mug cake mix. So working on that.
I'm looking forward to that. Well, we'll get right into it. Thank you so much, co-host Tamika and Dr. Marioneaux. It's just amazing how I met you. When I think about the referral that came from one of your, I think her name, anyway, I think her name is Janice or Janet, but came from one of your patients.
Oh, yes.
And she was like, did you like her? I said, like her. I love her. She's going to be my doctor. So I'm happy to have you here. And I will share a little bit about my experience with you as a patient as we go further in the interview. But to introduce you, Dr. Stephanie Marioneaux you're a graduate of both Harvard University and Harvard Medical School. You go, girl. You are an ophthalmologist who is fellowship trained in both cornea and external diseases and integrative medicine. Your focus expands beyond the clinical practice of ophthalmology. As a recipient of the Boyd Humanitarian Award, as an international speaker, an AMA award-winning physician broadcaster. Oh my goodness, I need to learn from you. And a recognized media trainer for global ophthalmic leaders. My goodness, what's happening, Sabrina? And as a media spokesperson for the American Academy of Ophthalmology. Tamika will tell you I've never stumbled. Well, here we go. You know, it might be something wrong with my eyes, okay?
Let's hope not.
which is why I need you. But I just want to ask you, why did you choose to attend Harvard Medical School? Of course, a fine school, but how did that come about for you?
Well, I can tell you as a pre-med at the time, I think none of the pre-meds ever think they're going to get into medical school, including me. So when I was accepted to Harvard Medical School, I was stunned. I was grateful. I couldn't believe it. And what really sort of tipped the scale, because I was accepted at just about all the medical schools that I applied, was that Harvard Medical School had a commitment to training African Americans. They were training African American medical students since the 1800s. And when I applied, they made the commitment to have 10% of their medical school class were African Americans. So I was just thrilled that I would not be the first. I would not be, sort of a very few in a class, that I would have wonderful support throughout my 4 years. And I knew a lot of the medical students because I was at Harvard College. And so I had met them. And then Dr. Alvin Poussant, who many people know was one of our deans, and we had female deans. So Harvard Medical School was just the place for me in terms of being able to get my medical education in a supportive environment, and to also help the fact that I was interested in ophthalmology, which is a very competitive residency program to be accepted into. So obviously graduating from Harvard Medical School would be a very helpful sort of feather in my cap to get into to be accepted into the ophthalmology training programs.
And we hear a lot, especially with Ivy League schools, about not seeing many of us within the school. So what support network did you have as you pursued your medical career?
It was the same. I was at Harvard College as well, and it was the same. Harvard University has had African Americans since the 1800s. And so there was a very strong African American community, both in the undergraduate and in the medical school. We had our organizations. My best mentors were the upperclassmen, and they would look at your schedule and they say, don't take that course with this course. That's too much. Take it the next semester. I mean, it was just, we had a wonderful environment. And I actually had a husband and wife physician team. They were both African Americans, the Hammonds, Ray and Gloria Hammond, and they wrote my letter of recommendation for medical school. So yes, and then also my sister was an undergraduate at Harvard as well. She was a year ahead of me, so she was an amazing support system to be there when I arrived, and then to have ready access to all of her friends. So I was very blessed, and I thank God I had a great experience for medical school and college at Harvard.
Well, you are a fine doctor. I can say that. I'm very pleased that I am connected with you as a patient.
Oh,
So what
thank
can
you.
we do? Most people don't think about, overall eye health. I mean, we think about the body, but when you think about overall eye health, the topic of this show that is the eyes are the window to the soul.
Mhm.
So what can we do without having any issues to take care of our eye health? Because unlike me, I don't think about my eyes until I have a problem with them. Of course, I, wash them, make sure I get the makeup off, but that's it. I don't do anything else. I don't know what else to avoid so that I don't have issues later.
That's an excellent question, because I think everybody has the notion that if it ain't broke, don't fix it. And they all feel as though I can see, so I don't need to get checked. But the challenge with the eyes is that they are such an amazing organ that they can function even when they are riddled with disease, or even after surgery. So the best thing you can do is to make sure that you get a complete and thorough dilated eye exam by an ophthalmologist, the eye doctor who graduated from medical school. Because as I said, the eyes are the window to the soul, and also the window to the health of your entire body. We can actually look in your eye and we can make the diagnosis of high blood pressure, high cholesterol. We can diagnose multiple sclerosis. We can diagnose brain tumors. We can tell you if you're at a risk for having a stroke in the very near future. We can identify various abnormalities in your heart. I mean, the list goes on and on. Various types of arthritis. We can diagnose leukemias, lymphomas. And so those are the diseases of the body, not to mention the diseases of the eye, like cataracts, macular degeneration, glaucoma. And so it is so important that you get this complete and thorough dilated eye exam on a regular basis. Do not wait until you think you need to come in, because there are many things that happen in childhood. They can happen as a young adult, and they can happen, throughout your life. The important thing to recognize is that if you are getting complete and thorough dilated eye exams annually or every other year, depending on what they find when they examine you, then you should not have the expectation that you grow old and grow blind. That is not the norm. We have so many wonderful technologies now to diagnose and treat diseases of the eye very early, but you've got to get in and get diagnosed. So please don't wait until you think you're having a problem. You need to get in and get your complete eye exam by your ophthalmologist.
Outstanding. And I do. I go every year, just because I have to, being with having contacts. But I want to know, since you mentioned it, we're talking about the eyes are the window to the soul, and you mentioned macular degeneration.
Yes.
I did not hear about that until maybe a decade ago. I knew nothing about it. So can you share a bit about that? And then we'll talk about glaucoma.
Yes, macular degeneration is one of the leading causes of blindness. It is much more common in patients who are Caucasian, but African Americans can get it as well. If you have a history of smoking, you're at great risk for macular degeneration. And what the macula is, if you think of the eye sort of with a bullseye, that small area in the eye is responsible for your best vision. So it's not the entire eyeball that sees. The vision is coming through the macula. And if there is an abnormality in the macula, if you have some abnormal blood vessels that have grown there, or if there's some fluid that accumulates there based on various types of diseases, sometimes it happens after surgery, sometimes it's in relation to diabetes, then you will have potentially a profound decrease in vision. And it's sort of like having a fist in the center of your vision. You will not have complete blindness with macular degeneration because you will maintain your peripheral vision, but you won't see anything straight ahead. It's, as I said, it's this fist right in the center of your vision. But we have wonderful treatments that have emerged over the past 15 years for certain types of macular degeneration. So we can really offer you hope, but you've got to get in and get diagnosed, because once you've lost the vision, it's always harder to bring it back. It's so much easier if you come in regularly and we can see the early signs that you won't see, and we can begin the treatment.
Thank you. My mother had glaucoma, and correct me if I'm wrong. I know she had to put drops in her eyes every day.
Mhm.
Was that to keep the pressure down?
Yes. Glaucoma we call it the silent thief of vision, because it takes the vision from the side, your peripheral vision, and your brain is so smart, you just turn your head. You don't even notice that the vision is closing in until you hit something really big. And you're sort of like, where in the world did that come from? By the time you've lost that much vision, you've had glaucoma for years, at least 10 years. So that's a really important reason to be evaluated, because there will be subtle signs in the eye that we will see, but you will not notice anything. And again, even with advanced glaucoma, if you're constantly turning your head, you may not notice that there's a progressive loss of your side vision. And we have excellent treatment. We have eye drops, as you mentioned, that your mother has been taking. And you will I always tell patients, these are your forever drops, because you will take them forever. So when the bottle runs out, you need to refill it. Okay. There is no cure for glaucoma, just like there is no cure for high blood pressure or high cholesterol or diabetes, but we have excellent treatment for it. You've got to get in and get diagnosed. And there are forms of glaucoma that occur at birth. There is a congenital form of glaucoma. So don't think that you aren't going to get it until you're in your 60s or 70s. I mean, I have teenage patients who I've had to put on glaucoma medications because they have glaucoma. So sharing this fact with your family members, if you have glaucoma, or if there's someone in your family who has glaucoma, every blood relative needs to know, because it is genetically transmitted. It is autosomal dominant, which means it doesn't show up in every generation. And that's why it's hard to kind of track, because it may not be a relative whom you know. It may be someone in the past. So I always ask patients, do you have any relatives that everybody talked about who took eye drops every day, or a relative who had a glass eye, which would suggest that their glaucoma got so bad they actually went blind. But we do have treatment, as you said. We have eye drops, we have laser treatment, we have combinations of that, and then we have ultimately surgical treatments for glaucoma. But in many instances, the eye drops work well, and so do the lasers. So you end up not having to go to the operating room if you get diagnosed early and you are treated early. That is always the key with any of the diseases in the eye and even in the body. Get diagnosed early so that you have a better possibility for a good outcome.
Hence the reason we should be doing annual eye exams so that can be caught early. What causes high pressure in the eye?
Well, high pressure in the eye is how we define glaucoma.
Right.
And it is genetically transmitted. So if you have a relative somewhere and you are the one who has that gene, there are actually about 5 types of glaucoma, and they're all carried by the same gene. So it depends on what you have. There's narrow angle or closed angle glaucoma. There's open angle glaucoma. There's glaucoma that results from injury. There's glaucoma that results from inflammation in the eye. And so again, you have to just have someone who has the medical training to be able to identify the type of glaucoma you have or the type of glaucoma you are at risk for, because you can have an injury to the eye and you may not develop glaucoma that day, the next day, or several months later. It may not occur until years later. And so those are the patients that we watch every 6 months so that we can see if anything is changing, because you will not have a headache. You won't have any change in vision. There will be nothing that tips you off that you have glaucoma in the early stages.
Very interesting, educational, which is what we like to do on Girlfriends Tea. As I told you, everybody loves the doctors. They're going to look at that because that's free information. We talked about that.
That's right.
Free information. Yes. And how do I get in contact with them? Which is great, advertisement as far as helping people to understand who in the community is able to help them because they are fully trained. And I especially love what you said, because I didn't know, as you know, that the eye doctor that I was seeing for years wasn't an ophthalmologist. I had no idea. I didn't know the difference. You'd hear the term, but I didn't know the difference between optometrists and ophthalmologists. Probably looked it up, but forgot about it. But I want to share something personal for me. About 10 years ago, I saw a flash of light in my peripheral vision. And, the internet can be dangerous, because I went and looked it up, because then I saw these little dots over my eye. And I said, oh my God, detach your retina. And at that time, I was supposed to be in DC in a week. And so I went straight to the hospital, the ER, and I come to find out I didn't have a detached retina. I had floaters. And I had to look up what floaters were. So explain that to us, because when I see the black specks, I thought those were the floaters, but in my reading, those aren't actually the floaters.
Well, actually they are, but
they are okay.
What it is that there is a gel inside of the eye that's sort of the consistency of partially gelled jello. We call it the vitreous, and it's kind of like shock absorber fluid. So it keeps the contents of the eye from rattling around with head movements and eye movements. But with time, the vitreous, this gel, can begin to break down into its component parts, which are clumps and strands. And that can happen after, you hit your head on the car door, you go to these wild rides at amusement parks, you have a motor vehicle accident. All of it is sort of cumulative until one day the vitreous, which is only loosely attached inside of the eye in 3 places, one area can either fully detach and you can see these floaters, these strands, these clumps that are moving around, or it can partially detach. And when it partially detaches, it tugs on the retina. And the retina is the nerve that lines the inside of the eye. And when it tugs on the retina, creating some traction, you will get the flashes of light. So when we hear that you have flashes of light, we're concerned that you could develop a retinal tear or retinal detachment. It's not a done deal, but you should be evaluated by an ophthalmologist if you have flashes of light. It is not necessarily an emergency unless you have missing vision. So say you have the flashes of light on a Saturday or Friday or whatever, and all the offices are closed. If you have full vision, and what I tell patients to do is to find a chair in their home that never moves, living room, dining room, look at something sitting in that chair, look at something across the room that never changes. A window, a lamp, a chair. Okay. And then you look with one eye at a time in that chair, and you're looking for a window, lamp, chair, one eye. Okay. Everything looks good. Thumbs up. Then you do the other eye, window, lamp, chair. Everything looks good. Thumbs up. Whatever you are experiencing, you can wait until office hours. If, however, you look and you say, window, chair, I don't see the lamp, I don't see my hand, that is missing vision, and that's when you need to seek immediate care from a retina specialist. I am a cornea specialist, so you would see a retina specialist to repair what is likely a retinal detachment.
Well, you know what? I'm already. You're my doctor, and I'm impressed. I'm going to give you a shout out right here. Come on. Cover that eye, everybody. Window, lamp, chair. Window, lamp, chair. I'm serious. Do the other one. Window, lamp, chair. Oh, we got you on that. Come on. Go ahead, Dr. Marioneaux. Y'all know I come to y'all with the best of the best. And she is the best of the best. Well, speaking of window, lamp, chair, I have cataracts. And so, as you know, things are looking a little cloudy for me. And I noticed it eons ago, over a decade ago, but I realized there was nothing to have alarm about. But my mom had cataracts. So hence the hereditary factor. So I was told, as you know, which is how I found you. I never name any doctors, but it's a lot of stuff going on out there, you all, even with major practices. And I'm not downing anybody, but I was told incorrectly. I was horrified that I had cataracts, number one, because I've never had surgery in my life, never. And I was like, oh my God, it's my turn, my eyes. And I was told, this is my opinion, but I shared it with you, but I was told literally, because I repeated it, that after I had the surgery, I wouldn't be able to see the speedometer in my car. I was like, wait a minute. I'm paying for what? I'm going to get the Cadillac service and I won't be able to see the speedometer. But you know what? That was God letting me know that something was wrong. And I got referred to you. And what happened with me, and I'm only sharing with me, what happened with me is that you'll explain it, but now I'm doing mono, one for near and one for far. Y'all, look, I don't even need glasses to read my cell phone. I'm amazed that I went a decade like this where I had to have these reading glasses. I don't need any more reading glasses. I'm so ecstatic. I was also told that I was ready for cataract surgery, but I'll let you explain that I wasn't. So I'll let you explain the mono and the cataract surgery.
Okay. In terms of cataracts now, don't feel singled out. It is the normal aging process of the eyes, just like getting gray hair. Some people get a little bit, some people get a lot, but everybody's going to get a cataract. It's the lens in the eye that goes from crystal clear to hazier and hazier and hazier. But we do not do cataract surgery until the vision drops to 20/40 or worse. Okay. And your vision was better than that. And what people always say, well, Dr. Marioneaux, how am I going to know when it's time for cataract surgery? And my response to them is, you will tell me, okay? Because it's when you are unable to see, drive, function independently, you see a lot of glare. Those are the time. That's the time when you would need cataract surgery, assuming your vision is 20/40 or worse. Okay, so that's really key. So she was very fortunate to be able to have really good vision. Once we refracted her, I did a complete and thorough eye exam. Everything looked great. So she was able to use the monovision contact lenses, which will correct the dominant eye, will be corrected for distance, and the non-dominant eye will be corrected for your working distance, your near vision distance, which is sometimes on your lap, sometimes holding it up. You give us those measurements and we can figure it out. And monovision contact lenses work great, but you can't have a dry eye. And the dry eye is now in epidemic proportion because everybody's staring at computers and TV and phones all day long and you're not blinking. So your eyes dry out. And so that can be a bit of a challenge, but we do have medications that will help, prescription medications that will help the eye produce its own tears. And then we work with you and make you understand exactly the gravity of the diagnosis of a dry eye so that you're able to maintain your contact lens use with great comfort, because the contacts must float on the tears like a lily pad on water. And if they're not floating and they're grabbing the surface of the eye, as you blink, it will be uncomfortable. And then you'll take the contact out and it'll feel like a suction cup. So if that happens, you need to be seen by your ophthalmologist so that they can evaluate the fit of the contact lens and determine if you need some of these prescription medications that will help to help your eye produce its own tears.
I'm glad you brought up the dry eyes because I'm going through that now, but I forgot to update you, and I'll update you here. They're out of my prescription, so I'm just using regular eye drops, but we'll talk about that later. They told me that they're out. There's a back shipment on that, but I do need to keep my eyes moisturized, so I forgot to update you on that. But at any rate, I want to make sure before we bring on co-host Tamika, let's talk about these fake eyelashes because I'm wearing mine. I'm wearing mine. I'm in media now. I'm sorry. I'm gonna wear them when I'm on because I need to pop. I need to pop. But at least they don't look like spider webs. And Tamika knows when I first started wearing them because I started wearing them when she wears them, and hers are gorgeous. But let's talk about eye health. So I'm going to bring on co-host Tamika because both of us are, interested in that. Both of us want to look good, but we want to make sure that we are on top of our game. So come on in the room, co-host Tamika. And so we want to find out, Dr. Marioneaux, about these lashes, and I don't know, I soak mine in alcohol. Is that right? I want to get all the gunk off of it. I just started doing that.
Well, you're going to need to find out whoever put the lashes on, they'll tell you how to best care for them.
Okay.
That's really key. And in terms of the lashes, you want to make sure that whomever is putting them on you really has the training, because if you're using the ones that are glued on, you want to make sure they're using the surgical glue and not the nail glue. That's a big deal. The nail glue will take your lashes off as well as other things. You also want to make sure you're not going to have an allergic reaction to the glue. So you can do a little skin spot test before and make sure there's no reaction to that. And then you've got different types of lash replacements. You've got the entire lash, and then you have individual lashes. And you just have to be careful because some of the individual lashes with the glue, sometimes it pulls the whole lash out, because you're going to get new lashes every 6 to 9 weeks. Thank God. They don't all fall out at once. They're going to fall out naturally. So if that seems to be normal, that's fine. But if you take them off and you now have spaces between your lashes, you've lost some lashes. The concern that we have with some of them is that they're just not cleaned properly, and people wear them too long, and they're afraid to really wash their eyes well, around the eyes. We're not suggesting you put tap water in the eye. We don't recommend that. There's a bad amoeba in the water, so do not put tap water in the eye. But just to clean your makeup off thoroughly every night. And some people are afraid to touch the lashes, so that it gets caked up with, more and more mascara. And then, of course, you have bacteria all over your skin. You have bacteria all over your eyes, and you have bacteria in your lashes. And believe it or not, even with fake eyelashes, you have bacteria and dust mites that are at the base of your normal lash. And so you've got to be really careful with these fake lashes that you don't overwear them. So whatever they tell you is the time that they should be removed, go ahead and remove them. Don't feel like you want to try and tough it out and get another month, because you may end up, when you take them off, your actual eyelid may be red, and you may have, in your eyes may get red, because the bacteria that will grow on your natural lashes will also grow on the artificial lashes. And cleaning them daily, you can decrease the amount that are there. But if you're not, they just grow and grow and grow. And as we say, at night, the bacteria from the top lid meet the bacteria from the bottom lid, and they have a party. And they will dump these poisons and toxins into the eye. So when you wake up, you can barely get your eyes open. They're like stuck together, and your eyes are red and irritated. People think you've got some kind of problem going on because your eyes are always red. So just, use care. There are different types. I know there's a type that has a magnetic glue, and you put the magnet on them. And I'd say just try and see what works best with you, because it's really going to be the glue and the care of your lashes, the lid hygiene. You want to find out, can I clean my eyelids and lashes without fear that they're going to come out or, be asymmetric or whatever. So ask them very carefully, how would I clean them? Because it may be just with a gentle Q-tip and some baby shampoo. there are many ways that you can keep the base of that lash as free from extra bacteria and dust mites as you can.
Excellent. I know, Tamika, I don't know if you have a question or a comment, but you have the floor.
That's excellent information. No other questions, because I really think you answered everything. Because as a female, lashes are just we need them. But you are right. It is very hard because I was scared to like wash mine, when I first got them, and then my eyes started watering, and then I realized I needed to probably wash them good. So yeah, it makes sense. Thank you for that.
You're welcome. Yeah. So make sure they're not too heavy too, because I've seen patients, they were so heavy they couldn't open their eyelids. So you want to make sure that they are, fairly light, so that you get full view of everything. You don't want to have beautiful eyelashes and droopy lids. So,
That happens to me. I'm serious. It's only the right eye though, and it looks like it's half closed. I'm so embarrassed. It looks like it's half closed, but I don't know. I don't know how to put them on.
Noticeable. Yeah. No.
So I'm thinking about
Just
buying a
keep that
new
in
pair.
mind.
I
Yeah.
am. After listening to you, I'm probably going to buy a new pair every week because the ones in the stores are not as expensive. But I want to thank you again. We're going to bring on Dr. Marioneaux, your husband. We're going to bring him on. But I just want to share with everyone that we have had a phenomenal interview with someone, Dr. Stephanie Marioneaux, who is more than qualified. She's exceptionally qualified. She serves on the Board of Trustees of the AEO, the Board of Medicine for the state of Virginia, and 3 terms on the Chesapeake Hospital Authority, and so much more. So you're a giver. You're a giver. And we appreciate you giving your time here on Girlfriends Tea. So we're going to bring on Dr. Harold Marioneaux. Dr. Harold, I know you had a wonderful time with us today.
Very enjoyable. Very enjoyable. I always enjoy listening to my wife.
Awesome.
Nice.
Well, we enjoyed listening to her as well. We want to thank you for joining us. So we have a phrase that we do. We toast our guest, Dr. Stephanie. So we're going to toast you, and we're going to say, girlfriends. And since your hubby is here, we say, guy friend. So now you are now officially a guy friend, Dr. Harold. And Dr. Stephanie, you are officially a girlfriend. Thank you for joining us here for this edition of Girlfriends Tea. I look forward to my next commercial with you, and we'll be keeping our eye on you.
That sounds wonderful. Thank you very much. It was such an honor to participate, and so great to meet you, Tamika. So you all have a great rest of the day.
You too, but I want to make sure I forgot how everyone can reach you. So if you want to reach Dr. Stephanie Marioneaux, then you will reach her here, sjmmediamastery.com, sjmmediamastery.com, and they can message you there, right, Dr. Stephanie?
They can message me there, or it's the same Gmail, so it's sjmmediamastery@gmail.com. So they can either send me an email or go to the website.
Outstanding. Excellent. And you all tune in to the next episode of Girlfriends Tea. Bye-bye.
Bye.
Bye.
Thank you.